computer. Okay. Hi, good afternoon, everyone. Welcome to the program in the second section that I gonna teach you on topic of selecting and critiquing occupational therapy research articles, supporting and contradicting the issue or an issue with reason and evidence. This topic gonna help you, gonna streamline you, and maybe can help you to go in depth insight for critiques and for criticize in terms of the occupational therapy journal. That is variety of the article. It might be quantitative, qualitative, or mixed method design. Okay, we're gonna go by step and step to step for understand. First of all, by the outline, the first I'm gonna talk about introduction to occupational therapy research, why it's very important, and criteria of selecting occupational therapy research article. And insight, the third is a method for critiques, how we need to critique from the abstract or insights in until about methodology, conclusion and discussion, and supportive evidence in occupational therapy. Why we need to pick up the evidence that to put in our introduction and put and for contradicts or maybe similarity or dissimilarity in discussion, and contradicts evidence in occupational therapy research. And the last one, the conclusion on future direction for occupational therapy research. Okay, critique is very important. How to how to select the OT article, why it's relevant, why it's related with our research now, not just including about the pattern of the research design is the same, but insight is contribution to knowledge or not. Sometimes it's not just only population is the same or the condition is the same. We need to figure out insight of the research article. Okay, introduction to occupational therapy research, OT research. Why it's so very important? Due to now we need evidence-based. We need not just only about publication, but inside most of people can use that the knowledge is very important or significant to imply or application to client, application to our OT setting or not. This is why it need to be used evidence in occupational therapy. That's provide base or the basic foundation of evidence-based practice to be the best practice, to be guideline, to make that or to make ensure that intervention are effectiveness or intervention is not just only go to the wrong way, it's the right way already, but need to be adapt. Sometimes because the culture, sometimes because this is have the barrier, context is not the same, but this is the evidence-based, based on the sound scientific evidence. In the previous time, we can use about what we call the base, the top of the pyramid, we call meta-analysis or systematic review, and RCT until to case study, right? And the second, the impact on the client outcome or the patient outcome. Research in occupational therapy need to influence or impact to the client outcome, leading to improved quality of life and functional independence. We need not just only about what we call just only about the component, but also we need about to improve occupational performance. We need to enhance the life skill of the client, because our aim to focus on occupation. They need to perform activity of daily living, to perform IADL, to perform social participation, to perform play education, or whatever they want to do activity to engage in that activity that they love. Okay. The third is advancement in treatment approach. Occupational therapy research can drive or can initiate the development of innovative treatment. Now we know about the new therapy or new techniques more than because this is the OT research. In the previous time, we might listen to what we call BOBA, PNF, and develop until to OT intervention like occupation-based intervention, occupation-based or score we call about many combined cognitive rehab or modified induced therapy, not just only about pure therapy, but we can use and modify with based on or strengthened by the research that is appropriate with our profession, like SI, sensory integration. In the previous time, is originate from the model of sensory processing, sensory development, but now it can imply and apply to OT intervention as the protocol. And because we have SI Academy already in USC, and if you want to be SI certified, you can go to practice at Hong Kong, Singapore, or even though in India, not just only go to the US. This is the advanced treatment approach that our OT society, we duplicate and we deposit, and we can learn from evidence and from the research. Okay, the challenges of and controversy look like contradicts and between insight into occupational therapy research. The new technology or the something make change, we need to follow with some new knowledge and follow with about the technological breakthrough. They know about the new era of the techniques that they implement in OT, PT, or rehabilitation. The first, we need to concern about methodological limitation. When we critique and we can try to evaluate insight, sometimes it's possible or not in our society. Randomized control trial around maybe one site or experimental around maybe 30 stroke client that on the control 30 stroke client or ADHD 35, another 35 is possible or not in this context. In Maharashtra, Chiang Mai is fit or not, or we need to go to another hospital. Think about methodology inside. Some occupational therapy research may face with methodological limitation. Some design can, like you are faced with or experience with COVID-19 at that time, me as well. Sometimes we cannot include or recruit the client into our core data correction, and we cannot give intervention for them due to we need to physical distancing and lockdown. This is make about the methodological need to be amendment with ethic again. Just only people, I change from RCT or randomized control trial to be just only about quasi experimental, or you just only about what we call is possible or feasibility that can impact to validity and generalized ability of finding. It's very important when we go inside of the methodological limitation. If it not limit our context, our lab, social lab, like I go to Doi Law, Mega, or sometimes go to Mae On near Central Kampang, and Doi Law is Doi Law district in Chiang Mai. The context is different, right? When context is different, methodology must be and need to be appropriate with that the area. That is the setting, so very important. Okay, if you use very long time, it's very hard. Back to the master OT, you study just 2 years, not maximum 4 years. Create in the future about research design methodology need to fit with setting, fit with your population or sample size as well. Okay, remind and keep in mind about this. The second is ethical consideration in research. It looks like about ethical dilemma can arise, can happen in our research. Post challenge and post something, it can benefit or taking risk with the client. Some insight we need to send to the ethic is cannot to do in this moment when they need to be evaluated. And some what we call some area we need to move to another area, we need to make amendment with the ethic and declare why missing, why it cannot follow with this protocol. If cannot, we need to be amendment or not, or need to be resubmit ethic or not. Think about ethical consideration in the research as well. In terms of when we use is make sure that is do no harm, not no harm for participant. And in the ethic, even though about our client in the outside, like stay in the community, we need to keep some. Now we need to declare about the participant sheet. We need gonna after we interview or intervention, we need to give money or give the reward or give the gift for our participant. But don't worry about our faculty of AMS and graduate student and graduates who gonna support money to you around maybe 30,000 baht. 30,000 baht. Someone got about what we call presidential scholarship. Someone got scholarship. Don't worry, in terms of this, under the supervision of your supervisor. Okay. This is for participant. We cannot use just only free. Use go to intervention, but inside after interview, after to do something, we need to give something for their sacrifice their time, sacrifice their what we call the valuable thing to give the engage in our intervention or our research. Okay, this is the ethical consideration about the we need to balancing about the benefit and the risks as well. What is the benefit of them when they join our research, or you got taking risks or not? We don't use the pill or medicine anything, but taking risks or not to do something about if we need to use about what we call combined cognitive with exercise. It might be walk or maybe and to think with walk, it's gonna be what we call lost direction or not, make them confused or not, or sometimes taking risks or not. If we use some instrument, no harm or not. Think about this as well. If it cannot, you need to declare in the participant sheet and its consent form as well. Okay. The third is controversy. It looks like contradicts. It looks like debate. In intervention is effectiveness or not. Most of occupational therapy is not 100% successful 100%. It depends on because we use occupation as a therapeutic media approach, right? It can fit with the client. It might be fit with this Mr. A, but it cannot fit with Mr. B because this is not their relevant activity. It's not just only pure look like medicine. You use about what we call about some medication look like the pill with some vitamin. Is the same vitamin? No, because this is the occupation based on intervention. The debate exists regarding effectiveness and about the intervention lead to be things debate or suggestion evaluation. This is why in terms of discussion is very important why we need to compare to Japan, compare to the US, the UK or Europe or video in our Southeast Asia. My OT research, like occupation based, I got my friend. He is the director of PhD program in Malaysia. The name of the university is University of Technology Mala. Now he done like me, make a occupation based, but he used intervention. But he deal with many people, not just only about in physical need function. Now he moved to hand rehab. He moved to people with mental illness as well in terms of OBP and OBI. Okay, this is I try to compare. He compare me as well, but we are the peer group to debate. What about the cultural difference between Malaysia and Thailand? It's very what we call challenging to do together. Okay, if in the future, if we have a time, I maybe invite him to join to teach to the PhD student in here as well. It might be one of the external examiner of our CMU AMS as well. Okay, to the next future direction of in OT research. We come to the new era. We need to accept the new event or the advent of AI, the advent of robotics technology. We understand the neural links, the new theory come a lot. We need to cooperate with technology in the research. Future occupational therapy may involve with leveraging about the technological breakthrough, including robotic technology, including telehealth, telemedicine. Everything is an advancement, technology advancement help OT to do something is the new window for the client because it can enhance about the assessment and intervention strategy for the client and make the client to be better life. Even though now in our Chiang Mai provincial administration that we call OPJ, right? Thailand decentralized from centralized, okay, to each province. Chiang Mai or Chiang Mai provincial administration receive about the telebox. The doctor can go to telebox, okay, and can examine the client, but the client didn't come to the downtown of Chiang Mai. The client go to, they stay in Omgoi district. They go to small or local hospital at Omgoi in health promoting hospital or we call Raposotol. But the doctor can examine with the telebox and the client go to the telebox as Omgoi district, okay, at the top of the mountain at Omgoi. And after that, when finished already, that doctor can paste and the medicine or medication can load and go directly because the signal go to Omgoi already. And that client can pick up the pure medicine, go home. This is one kind of the telehealth and telebox from the new technology. Okay. The future direction we need to think about, explore about diverse cultural perspective. Is very cannot we cannot lose about our identity. Not just only says what we about technology, we still preserve our culture. And now I join with Surakarta, Indonesia. I join with Philippines, even though Japan. Last week, I taught the student from the US, right? They have many culture. Some culture is very quite weird, but we need to respect that culture. The growth of this, we need to explore how occupational therapy can be tailored, can be pro the word of the cultural context, and driving future research direction. You can see now Chinese people come to Chiang Mai. They call Chiang Mai Gua or one of their province like in the mainland of China. Unbelievable. I come back here. A lot of Chinese people are there in Chiang Mai, a lot. But they bought their house by nominee in Hang Dong, in San Kamphaeng. Their culture is different. Once in the future, we need to maybe to receive them if they got their child become autistic or they got stroke, they come to our clinic. We need to intervene with them, right? We need to respect their culture and they need to respect our culture as well. Win-win situation. But this is diverse culture have a lot, not just only AEC, open throughout the ASEAN in 10 member nation, but we need to think about what about their influence from the culture, especially urban, city, and rural area. Is very challenging about the how to do and how to find out about the research, finding about cultural difference. Okay, except now we got LGBTQ, we have variety of religion. Okay, from the south to the west, from the east to the northeast as well. Okay, future direction, another promote interdisciplinary collaboration. We are not Superman. We need to stay with friend in health provider. Future research need to be what we call across profession, held together. Now we have IPE study for our student. IPE we have the doctor or faculty of medicine, faculty of AMS, nurse, pharmaceutical of faculty of pharmacy and dentist and veteran to stay and together to learn, go to community together. That is we use about interdisciplinary approach for the client. If we work like this, when we do a big or mega projects, big project from what we call from Ministry of the Higher Education and Research Innovation, is the big project. It's not just only 10 or 1 million baht or maybe 10 or more than 20 million baht. It's not just only about our one profession. Like I used to join with about the projects 2.5 p.m. in Chiang Mai, how to reduce and how to stop 2.5 p.m. It's not just only about what we call about the people from what we call to do just only from Faculty of Science, but they come from agriculture, medicine, PT from lung, OT about cognitive. Think about 2.5 p.m. in Chiang Mai. This is promote interdisciplinary across between about the borderline and held together to one project. Okay, this is my very important in the new era. Okay, foster about collaboration between occupational therapy and other professional to do. Okay, for solve some problem. Okay, criteria for selecting occupational therapists, occupational therapy research article, how we find relevant of research article in occupational therapy. The first is relevant to occupational therapy practice. The research article should be or should directly related to our practice and principle of occupational therapy. Now we are MSc OT student. We need focus on occupational therapy. Go inside into occupation to make sure that it's based on principle of occupational therapy to ensure that this is practical application. Okay. We need to concern some occupational therapy research is I show you last week have around 30 research publication on publisher, but they still in another presumably right occupational oxide journal located in social science, but it's occupational therapy. Some occupational therapy like occupational therapy in mental health is not located here. It's located to psychology in another field. But this is occupational therapy. Okay, not just only use about the database. We need to find relevant some journal like stroke rehabilitation or stroke and heart or topical in stroke occupational therapy article is located there. Or even though I am editorial board of the post one and I am the review of post one. Post one still have OT. Or now F1000 still have OT. This is one. Or many kind of research. It look like open disciplinary team or disciplinary what we call profession is located at OT inside. Okay, look like public health or health. Even though about Journal of Health and Environment for Health, VROT can publish there as well. It's about home modification, assistive product. Okay, we can publish in home and health as well about this research. Okay, the second about clinical and functional impact is too very important in the research relevant. We need to think about go to about clinical implication is for function or is called boost our cell to understand OT more or not. Article should demonstrate clinical and functional impact of intervention. The insight is conclude about strategy, techniques, or OT intervention inside of the clinical and functional impacts. And the third, we need to concern in relevant of occupational therapy research is population and setting. I used to, I plan to go to study PhD after I graduate master degree in Newcastle already. I'm gonna go to what we call Cardiff and talk with Dr. Jananya and gonna go to somewhere in East Anglia in near the south of the London. And at that time in both area, most of in East Anglia they study about falling with snow in snowfall or winter time. I think it's not appropriate with the Thai people, Thai population, because we don't have snow in Thailand. But it's slippery. It might be taking risk as well, but it's not snow. If I do that research, it might not help for the Thai people. This is why we think about in terms of population. Okay, in Cardiff University at that time, Dr. Jananya, I talked with her. Dr. Jananya said the lab is not appropriate already due to they have a new lab and they're gonna be framed with many infrastructure at the lab that I still keep going in terms of stroke rehabilitation. But I forgot to ask my supervisor, can I pick up and collecting my population or my sampling in Thailand that I have a right. My professor say, yes, you can back home to collect data in Thailand. That is pay back to our country is population and setting. Okay. Sometimes when we do something, we think about population and setting is very important for the research to conduct as well. I should Doi law, but I think this is Doi law is the matching fund of it look like about target setting of our faculty, but it's around maybe 1.5 hours when we drive a car. It's far from Mueang district, Hang Dong and San Patong and Doi Lo. It takes time, but if we plan to do already, we need to plan advance more. We cannot plan today and to go to today is very hard. We need to plan, and next week we need to prepare everything. Prepare already. We're gonna go and what 1, 2, 3, 4, 5 until to be finished, and we come back from the morning until to the evening like that. Setting is very important as well for collect data. Okay, when you come to read the article and read about their setting in the urban, in the mountain, or near the offshore or the rural area, or just only in the lab or in the room, okay, or in OT clinic setting, okay, for conduct the research, okay, to ensure it's applicable or applicability and diverse context. Some context is very different. Some area of setting is very different. Look like about the secondary hospital and tertiary hospital or local hospital. Look like about health promoting hospital, health promoting hospital like Lokosoto in Thailand. Now we try to what we call distribute and help people, or even though about health provider in local hospital. In the future, they will be our node or our about the branches, because the budget from the government, from the municipality support a lot due to about the community-based rehab. Think about this as well in terms of setting community methodological rigor. The methodological rigor is look like this is strong with what we call strong with about the protocol, is with about validity. When we use about methodology, we need to evaluate, read about article journal. You can evaluate the research design, insight. Is this mixed method or not? Is what we call, this is the exploratory sequential mixed method, or is maybe can become to explanatory, not exploratory, or sometimes it's use qualitative first, follow with qualitative, or use qualitative first and follow with quantitative, or sometimes it can use merge together. We call divergent. Look like frame, look like what we call integrated frame of methodology. This is research design. Sometimes pure quantitative, look like about intervention, pre-post, and use control and use about experimental group. Sometimes you just only pre-post with just only about case or experiment, look like quasi. Okay, sometimes you just only cross-sectional, just only survey. Sometimes survey, long survey, not just only one phase, but 2 phase, 3 phase. This is longitudinal study. Methodological need to be things and concern, because it's effect to the data collection. The how long, sometimes use around, I drive the car at the time, stroke rehabilitation in Thailand. I went to the regional or headquarter hospital, 6 regional hospital. In each 6 regional hospital, one area I use around maybe 2 months. I use around 1 year to collect data, intervention, and interview. In 6 regions, in the north, in the south, in the northeast, in the central, and in the east region. In the north, I go to Lampang. Lampang is the headquarter of hospital, and Phrae is not enough. Go to Phrae as well. In the east, I go to Ratchaburi Hospital, and in the south, I go to Surat Thani Hospital, and in the west, I go to Chantaburi Hospital, like that. Sorry, swap with Ratchaburi in the west, and in the east go to Chantaburi, not Chonburi. Chantaburi Prapokam is the regional hospital, like that. Okay, this is, we need to be think about how to correct data from region to region or from the area to area process to ensure that scientific rigor is strong, is enough or not, is appropriate or not. It might be too general to imply, okay, and validity. Okay. The next is statistic analysis. Statistical analysis need to be think first they can use one way ANOVA. They can use Wilcoxon test or Mann-Whitney U. They compare or not. Okay, or you just only linear regression. Okay, and now if in terms of the qualitative, don't have statistic. They use the analysis. They use thematic analysis. They use case cost analysis. They use what we call content analysis to analyze the wording when you interview with the client. They use the program in vivo. They use the program of not just OSPSS. They use Atlas TI or not. In the future, you can learn about the quantity and you can mix together. Because occupational therapy, sometimes it cannot measure just only a number, right? The emotion, behavior need to be explained by wording. And we need to analyze wording from many participants. And we can combine together how use the method to approach about this, okay? And ethical consideration. Examination of ethical consideration and adherence with the research ethic is very important. Even though about ethics, they didn't what we call involve with to change about methodology, but inside that method gonna make the client do harm or not. If no harm, they didn't to interfere about this. But sometimes some ethical committee, they very mercy to help you. Is possible or not in terms of about this. They likely to, or if it's prolonged, this is not just only Nobel Prize, right? It's just only the master level of thesis in the future, right? Or just only PhD thesis, not just only 10 years. I need to longitudinal collection. No, this is not go to just only about, you need to know about the timing, okay? Ethical consideration about this as well in terms of the participant. If we use about qualitative, we need to make confidentiality. We use pseudonym เป็นชื่อที่เราต้องเปลี่ยน we use ชื่อแทน okay pseudonym. We don't use the real name. Look like PDPA to protect about their character, protect about their characteristic of the client, right? This is very important. Even though about, okay, the client can sacrifice, but in the real, we need to be scientific. This is methodological rigor. We need to share to be scientific framework. We don't use the real name, use the pseudonym and confidential about the area or something, okay? Not to go to link to clarify about their identity or clarify about their characteristic of the client. The topic about the contribution to occupational therapy knowledge. This is very important that you need to read about the article. Even though we do the research, some reviewer and some editor welcomely, well designed, but where is the new knowledge? Good aim, good objective. Where is the new knowledge? The new knowledge is very important to grab, to pick up about this. When we spend the time to read, what is the new knowledge to pop up in your head? Innovative approach and intervention. This is the new. Maybe they got a new paradigm of the intervention. They can modify. It sometimes can originate from that model, but they use another way, and they use with you can identification of innovative approach, intervention that contribute advanced occupational therapy knowledge, or they use this what we call about mirror neuron therapy in stroke, but they never use with the people with Parkinson, presumably mirror neuron. And you set up about research question is maybe use mirror neuron therapy and can intervene with the Parkinsonism and it can better. If you got, this is the new paradigm of contribution to knowledge. Okay, what is about you can generate into application that we call contribution to knowledge. And more than that, if you got contribution to knowledge, you got the knowledge for the new population ready in your context, and you can make that research can make a knowledge transfer or not, or knowledge translation and application. In the future, if you do the best, some people make a systematic review or scoping review or meta-analysis. They're gonna use that your research or use that research you read to be a one of the systematic review article, right? This is knowledge transfer or knowledge translation. Discussion how research contribute to knowledge translation and its potential for application in OT setting. When we do something about for intervene with the client, we try to pick up about it can work or not, effective or not, how many sampling, how many sample size. If we read about systematic review quickly, because they try to use about statistic network meta-analysis for you already. And conclusion, this way is very good. Look like the systematic review about the sprinting in stroke rehabilitation, it does not work. Air sprint is okay. Now anti-spastic sprint we cannot use and to provide with the client. We can learn, but evidence is still evident. They use not just only 65, they use more 100 and some article, this article or proof already. Sprinting in stroke, it does not work. Why we need to intervene with the client with sprint for stroke? Because the evidence already. This is knowledge transfer, knowledge translation ready to practice. We need to economize the money for the client. Okay, if you got just only spastic, if you want sprint, okay, use air sprint, it can help them to prolong staging to relax. Okay, it's okay. Still have evidence. Okay. The next is implication for occupational therapy practice or not. This research article. Think in terms of exploration and implication of research finding. It's enhance our OT practice, enhance our OT identity, and improve our client. In the future, it's become to be Bible. It become to be one of the principle. It's become to be one of milestone. Okay, look like in the previous time, SI, just only the framework. Now SI become to be not SI just only technique, become to be framework, and now become to be model, become to be academy. Use that protocol or not, okay? Or some technique or some intervention of OT, okay? Now it can try to develop to be implication for OT practice. Let's make our OT society to be expansion, to be development, okay? Method for critique occupational therapy research article. The first, you need to be evaluate research design, okay? Before go to each of the quantitative, qualitative, or mixed method, validity and reliability of research design is very important. We need to access about validity and reliability of research design to ensure that its creditability, it makes sure that it's relevant, it fit with its strong framework of research design. Validity and reliability, not just reliability for, okay, how many rely use about SPSS to calculate. or use about validity about the internal consistency. This is rely and validity in terms of research design. Just and things with your supervisor. Okay, it might be omiss or miss something. How we mix store. We use just only about intervention is work or not. We never think about their expression. Use questionnaire is enough or not. We never heard their voice. Why we need to interview? Okay, change or develop research design to fit with the context, to fit with research question. Second is approaches or appropriate of research method. The approach of the research method is very important. Critically analyze appropriateness of research method. Use about study address research question. It looks like the way that we go, right? If the way that we go or the journey that we go, if we don't have about the tool, it's very hard to go to direction. It looks like magnetic compass. This is the north, this is the west. Okay, we lost direction. We keep use the magnetic compass back again. Okay, to set up. Okay, go this direction because this is the magnetic compass point out in this way. Use this appropriate research method. Some research methods use not just only one paradigm, can draw the information. It's enough, it's enough. But some information, maybe you can see they need some another method. This is why mixed method come to as well. Some use just only experiment is okay, it's enough because it's more sample size. It's much more sample size. Some is very small sample size, but need to allow voice to strong to support about experimental design or to support about questionnaire or survey or not. Okay. The third consideration of ethical implement or implication. This is try to evaluate again in terms of the ethic, in terms of in the method to employ or exercise about study to ensure participant safety and confidentiality need to be keep and cover. Don't generate or lead to clarify about characteristics that make do no harm for the client, for participant in OT. But we make sure that it is safe in your computer. If you use a picture to your research article, you need to use about the red card, or you look like to blur some picture, not identified for the client or for participant. Analyze the sample and participants is very important for the client. Is conclude what we call inclusion and exclusion criteria. Is representativeness. The representativeness of the sample is enough or not. Is creditability. It means that this is the real chronic stroke or not, or we need to just only stroke in terms of about the golden period, or this is ADHD client, but they interfere with some mixed with another, or they still multiple disease. We need to exclude or not. Access the representativeness of the sample to determine if finding can be generalized to target population. Sometimes they use about the formula to generate how many sample size. We use Yamane or we use another formula to find out the population. Look like older people in dialogue. We use Yamane. We use because we know about their population. From the law municipality got the database. And after that, we need to survey around around 380. But in the real, we just only can draw and can what we call collect data just only 310 and lost some 7, we remain 303. It's okay, around maybe 7 to 80%. Okay, but this is the representativeness of the older people in Doi Law. But compared to disabled people or people with disability in Doi Law, they have around maybe 1,000. But in the real, we can God just use their money to fly out. We use just only about 84, 85, and enough of the disabled people to collect data. This is why we use about access, approach, appropriate with the representative of population. Inclusion and exclusion criteria, we need to critique what is consent and what is content inside. Correct? What is this is inclusion criteria. If we can intervention with some client or can do the survey with therapists, they got experience in elderly people. If they don't have experience with elderly people, we don't include them to be inclusion criteria. And they got what we call national license or not. If you don't got, and maybe you can work with or can work with as OT in elderly people more than 5 years. This is inclusion criteria. It's just only 4 years we exclude. Okay, that is we need to do about the inclusion and exclusion criteria in terms of sample and participant. Okay, for selection. Participants' characteristics, analyze and demographics. That is can show demographic data in journal or in a research article. Clinical characteristics need to be known, all right? But about the name, the real name, we try to blind or try to blanket. Don't show anything about the identify of the client, because to protect confidentiality. Participants to understand the relevance of study in terms of OT practice. Okay. And after that, before we're gonna do, we need to give some consent for them and allow them to join with the research. The next is evaluate the result and conclusion. Statistics is we need to find out in terms of analysis, interpretation is evaluate about this interpret result is can strength or not. Strength of finding is if it's thick or insignificant or it cannot show about the difference, is you can give the reason why in terms of discussion. Sometimes we think it's significant, but in the real maybe what? Because sample size is not enough or not, or we do just only selection by ad or not, or you got the something you need to be think about in terms of about if it's become to resolve already, we cannot change. We used to speak the truth, and what is the possible? Maybe back to objective and research question again. Why is that our things are like a model or like what we call our setting of the research question like in the previous time? Is maybe possible. Sometimes we can see about occupation-based practice and robotic technology compare together and compare with about the control. When compared with robotics in hand therapy and occupation-based practice in hand, it's not significant. It can same. It means that we can suggest about the hospital didn't buy. You don't want to buy or everything robotics, right? We can use occupation. But if it's significant, why? Sample size and inclusion criteria is fit with or not in terms of discussion. Okay, consistency with existing literature. This is why literature in interior review and the result, and it's gonna lead to discussion. It's going to look like a sausage, sent to like coherent together. Okay, access about this is novelty, is the new or not? Contribution, what is about existing? They show like this in South Korea, but it never show like this significant in Thailand. Okay, this is why you can find this component with the client like autistic spectrum disorder happen like this in Australia, but we use this way like Australia, but in this component is going up like is significant in memory or is near significant. We see the trend. It might be about what we call the culture. It might be about the what we call intensify of intervention of us. We use, it means in the future we use just only six, what we call, we use 3 times per week in 6 weeks. If we, and in Australia, use just only 4 weeks. In the future, if we use 8 weeks, it might be better or not. That is from literature review to result and hope or go directly into the discussion. Implication for occupational therapy practice examine the implication of finding with of OT practice and identify potential to further research for intervention development. Okay, in the future we need to suggest for a new researcher, or if you want to do in the future, we're gonna do like this: future direction, future suggestion after we got about the result. Supporting evidence in occupational therapy research. Okay, the first is quantitative. Quantitative is the number. Research in the number world, not just only about textual data. This is numerical data or number data. Okay, effective of occupational therapy intervention for stroke rehab. They use evaluate impact OT intervention on stroke rehab outcome. Use quantitative measure to find about functional independence and quality of life. Okay, they use to find about maybe WHO, the WHO brief quality of life or something like that. Occupational therapy in pediatrics, in sensory integration. This like, for example, they use SI for effective of SI intervention by OT, by therapists to improve sensory processing and functional performance in children. And this is the protocol, and they measure in terms of quantitative. Occupational therapy intervention in dementia. This is in mental health, right? In dementia dementia people got older people, and they got likely to be from mild cognitive to dementia in the future. This study evaluates the efficacy of OT intervention in managing dementia-related symptoms. They use how management, enhance daily living or enhance daily functioning. Use quantitative measure cognitive ability or cognitive to improve cognitive decline, to strengthen cognitive ability in activity of daily living. And in quantitative occupational therapy and for prevention in elderly people or elderly population, this OT program can reduce falling risks or not, because the client, like older people, likely to be falling down and they broken bone really quickly. How to use this program can make to improve balance of older people or not. They use analysis. Maybe they use about balance test as well to reproach, and they use about how to do the program, use about the practice in terms of the what we call strength of their walking. maybe join with the PT as well. This is, for example, my research in reliability and internal consistency of Thai occupational therapy, Thai activity class source for stroke rehabilitation or for stroke survivor in occupational therapy unit. At that time, we make look like ACS or activity class source for stroke. I pick up from the client from stroke in regional hospital. This is the small branches of OTMCS Thailand. At that time, I collect intervention. This is for collect from the client. What is your activity and make to activity class source for stroke survival? And it can generate into about the class source for stroke to Thai, just only stroke client for Thai people. In the real, we need to do not just only stroke, we need to expand more for elderly people, for teenagers, activity class source. This is, for example, quantitative study. This is another for Taiwan or Q1. We publish in post one. We try to find out caregiver of Mae On village in San Kamphaeng. They have burden, and we need to find out when their caregiver taking care for people with disability. We use about the quality of life brief Thai and we use about PSQ and Battelle index. We measure with IADL of the Lawton, and we summarize what is going with about the how to predict caregiver they got the burden or not in their job for their relative with physical dysfunction in rural area or in our time. And we have about the information in terms of the quantitative or the number data. Qualitative research, you might someone experience with, someone are not experienced with. Due to qualitative is another paradigm because it's not the number, it's the textual data for the client. It might come from interview, it might come from focus group analyzed by thematics, contents analysis, use about case cost study. For example, occupational therapy role in mental health recovery. They export experience. Experience is not the number. They can generate and they can tell story. Individual undergoing with occupational therapy program or condition. This is show their reflection in terms of their benefit and challenge with about the interview and use about thematic analysis to analyze. And another occupational therapy in vocational rehab. Some workers, when they work and they experience with something to do, we examine about the perception and experience in terms of OT, vocational rehabilitation program. And what about their feeling? This is why we use about the qualitative to grab and to collect data from them and interpret in terms of intervention. They might be feel better, feel good, feel guilty. We don't know. It depends on their voice. Okay. Some qualitative focus on cultural consideration that need to be concerned in OT intervention as well. Explore about the cultural factor, effective or not, or influent or not, in terms of about implementation and the outcome of OT intervention. Use qualitative method to understand about the perspective and experience. Some perspective and experience is not the number, is textual data. That is their vision. This is their thinking. Okay, they cannot rate things, right? Some emotion is very hard. Not just only happy, unhappy, but feeling inside is very. You fit with, you engage with some situation, and you can generate in terms of textual data, not numerical or number data. OT for chronic pain management. You can use scale pain, but in pain feeling, pain is not just only about level 1 to 10, but some pain is cannot very high. They manage in term investigate about the life experience of individual about receive OT for chronic pain. Use qualitative for draw about information, draw about insight. After they receive OT intervention, they manage pain better or not. For example, this is carb activity as a meaningful occupation among clients with schizophrenia in Thailand. Is my research in Bangkok, in somewhere around Ratchanakarin. I interview with the client in schizophrenia, even though I'm not specialized in master in mental health, but this is the role to play. Need to find and join with my wife as well. My wife, she is occupational therapy and serve at that hospital, and it can find out what is the meaning of occupation after we use carb therapy, carb activity, woodworks, use little and used to do with about the sculpture, with about the wood, or with some to make something like handcraft. They're very what we call feeling better in terms of the schizophrenia or people with this schizophrenia. They can relax, not stress. Okay, and use one kind of the base of OT in the previous time, because we use carb like as like therapeutic media for the people with schizophrenia or mental health is a better, but some better is not measure with about assessment. We use just only about qualitative to draw their feeling, okay, or their experience. Like this is for what I want in about me as well. Deliver occupation-based practice in stroke rehab in hospital setting. After we measure with what we call with quantitative, sometimes we need to know about their experience after they receive OBP already. What your experience. This is why I set the research question to ask the client, as stroke client, what's their feeling in here, and they can use about the perspective of toward OBP. And at that time, I interview with OT in Bangkok, okay, in Bangkok, that they have experience to work with stroke client. In Bangkok have a lot, right? In Chulalongkorn, in Prabongput, we interview with this, and we have the content and we have the message. After that, we put into about the phenomenological study, and we can analyze by thematic analysis, okay, and publish in the qualitative report for Taiwan. Mixed method. Mixed method is most to do mixed method is for PhD. When you study in the UK, or you study in Australia, or study in the United States, even though we do something, we need to do make bigger. Mixed method is the ones of the method more than just only quantitative. It's been combined between quantity and quality, and to do for the client, or to do something what's about research. Can tell you to cross the gap or bridge the gap, that some experimental design is weak or not, or just only number is weak, qualitative gonna support, or qualitative use weak and quantitative gonna support. Okay, this mixed method combined together. Occupational therapy, community-based rehabilitation, I use both. Okay, integrate, combine between quantity and quality, use quantity outcome measure with follow with qualitative feedback, okay, about what going on about holistic impact on community-based occupational therapy program. Now we do like this in Doi Law as well. I'm waiting for the result of the under review now of the Doi Law. We use make method to collect data from older people, not just only about or quantitative that we interview individual. Occupational therapy in adaptive equipment provision use quantitative assessment and follow with qualitative feedback as well. In terms of adaptive equipment, provide comprehensive understand for the client or not, effectiveness for them or not in terms of their reflection. Some people we can interview with look like OT in palliative care setting. Some people got chronic stroke, they are cancer, they are stroke chronic already. We need to know not just only about the number. We can use mixed method to access holistic impact on OT intervention and quality of life with symptom individual and receive policy care and integrate with qualitative draw from their narrative, from their story. Okay, occupational therapy in autism or autism spectrum disorder intervention. Just only intervention with children, but interview with parent, with family is better. We know about effective because we measure about the autistic child already, but we interview or make a focus group with the group of the parent. That is the mixed method to do. For example, this is my research impact on or impact of OT or impact of COVID-19 pandemics at that time. Mental health, lifestyle in Thai occupational therapy, student and mixed method design. At that time, we try to measure student to effective or not, to what their feeling in terms of COVID-19 impact them or not. We try to use T-SPA that of Ajahn Thiam, could you remember? Even someone know Ajahn Thiam, use T-SPA, and we interview with the student and we combine together to be impact of COVID-19, impact on mental health and lifestyle. And we use not just only lifestyle of them to use draw in terms of number, but we combine with about interview to the OT student in Chiang Mai. This is one kind of the about the mixed methods as well. We try to find out the sprint that we study in bachelor level, but it's important or not. We learn a lot, many kind of pattern of sprint, right? At that time, and it's common sprint need. We don't want to learn sophisticated or more than complex sprint, but we never use in hospital. This is why we try to find out about research question. If we learn many kind of sprint, but we cannot use, we use just only 5 sprint enough or already. How we gonna set up the research? That is, we can bridge the gap between clinical service and academic education. It means school OT school, and hospital need to go to the same way. If we learn much more, but we didn't use, what does this mean? Lost time, right? We need outcome, effective. This is we focus on. This is why this research need to focus, why to find out from OT that's expert in sprint throughout Thailand. And after that, we interview with them. Okay, and we have the common sprint use a lot. Not just only more, it's around maybe 5 sprint. Okay. For example, about this as well, about quantitative and qualitative as mixed method that we publish in about disability and rehabilitation. Factor influencing implementation assistive technology service for older adult from perspective of Thai occupational therapists, a mixed methods study. At that time, I am co-supervisor of Ajahn Om or Jirati. Now he's gonna go to Japan again for continued PhD. At that time, he done master level in Japan. He studied, but he collect data in Thailand. I am his supervisor in Thailand, and his main supervisor in Tokyo, Dr. Kauruk. We help together to find out what is relevant for about the assistive technology for older people in Thai perspective, okay, of occupational therapy. And we come to bring quantitative is the number, and mixed with about the data about the textual data or the message from interview. Okay. Near the last evidence-based practice come to look like to when we finish everything, most of the research come to look like about the protocol. The evidence occupational therapy intervention for upper extremity, why we need to do like this? Because it's evident for support about various occupational therapy approach in improve or strength upper extremity following injury based on current practice and guideline. It's become to be guideline, clinical guideline CPG already. Some look like about what we call stroke guideline we done together because it's become to be evidence based. Okay, occupational therapy in home modification aging press now it's become to be evidence based as well. We draw like this and implement in Thailand. Sometimes it can to be protocol, but sometimes it need to be fixed due to 5 years, right? Need to be revision again. Occupational therapy in handling or handwriting intervention for children. Now they got about the evidence why you need to provide and support about practice, about the what we call learn everything and practice to improve handwriting for children, even though the kind of children is learning disability. The last one, for example, occupational therapy in work rehabilitation program as well. This is now we move to about the pattern area of work. Some people didn't open this area. I try to do with my master degree about the work area with neurodivergent of young adult people. Because it's important, we have didn't open about work. We deal with ADL, with social participation. We open about work participant, and social participation is very important for about the client in terms of vocational rehabilitation. It's transition period that due to Thailand, we not just only ADL and IDL, we even though we are adult, older adult, mental health, after we practice ADL better, most people go to work. Thailand is not wealth country. Thailand still developing country. It's not look like about the developed country. They got leisure. They got they if they retire 60, they didn't work because they got pension, right? But Thailand 70 still work. This is why area work is very important for OT society to do. And the new innovation, we need to think in terms of innovative OT for the future is technology, assistive occupational therapy intervention. AI come very fast now. The event of AI can change the world. Technology about this can help and can look like about positive and negative. If you use positive, it's gonna build you. It's kind of building block you to be know about the what we call about the scaling, about the speed up to do something, to look like a leverage for the client. Don't take a long time, but client help to do. Look like telehealth, telemed, okay, to give them for technology-based intervention, exam potential benefit or challenging with new technology for solution. Some people stay in the jungle near the top of the mountain. Technology can make change. Long distance is very close up because technology, okay? Another is occupational therapy in nature-based occupational therapy. We try to investigate in terms of nature activity. If you think in terms of about the treatment planning for people in the hill type, in the people what we call another culture, the nature of them still very pretty, still very what we call is not disturbed. We need to respect and use that way because about the nature base of the occupational therapy need to be implemented for them as well in terms of the treatment planning. you intervene with Islamic people. They need to go to mosque. They need to go to what we call the Islamic community. They got something is different. We need to keep their nature to do like that. Even though about mom feed by milk, the nature of this, don't use a new milk from powder milks or some milk. We try to preserve about the nature of occupational therapy like this. And very powerful now is mindfulness based occupational therapy intervention. Someone know it can change your brain, the brain wave about your concentration, your relaxation. Occupational therapy still use uh, mindfulness-based intervention for promote some activity. Sometimes we can use with about people with last life, prepare before go to pass away. People chronic like cancer. Mindfulness is very important. End of life. Have you ever heard end of life? End of life of people OT intervene with in the previous time. Some people use just only monk. The priest is the help, is the what we call the provider. In some countries, very powerful use OT for make a mindfulness for people got chronic, and they can calm down and they can think about the life. And now is can accept. It need to be open to the next research a lot in terms about mindfulness based occupational therapy intervention. Okay, near the last research initiative, I think it's still in your head. You need to initiate, conduct to explore some occupations. To me, occupation-based intervention and occupation-based practice is now I need to come back to be occupation in practice or occupation in therapy. Need to be come first and try to expand not just only my specialize in stroke rehabilitation. I expand to physical dysfunction, expand to mental health in the future, expand to pediatrics and elderly people and community. Okay, that make knowledge translation effort to translate the research finding to another, not just only copy or duplicate, but can adapt and modify to fit with the client in terms of occupation-based intervention from the client. Okay, and we need to make ourselves to as professional development in terms of continue. We cannot go to the end. We need to continue professional development in terms of emphasize enhance knowledge and enact our skill. Think about as our OT practitioner to find out evidence and use in terms of evidence-based practice for the client. Even though about technology can absolutely can make one thing the client back to do to engage in occupation, to engage in meaningful activity. Data collection and analysis need to be prioritized. Think about first priority in terms of access, evaluate the effectiveness of occupation-based practice or for occupation-based intervention for the future that I do for evidence-based in Thailand. Now we have evidence-based in Thailand, just only 2 papers. This is my paper, occupation-based. You can search occupation-based in the database, in the world database, just only British Journal and qualitative data. We try to expand more that our the perspective of experience to study, right, from Kearney, that I think in the future I can expand more. My OT master nowadays remain for because published graduate one already. Now she joined with Cathay Pacific. She then become to occupational fields. She follow her dream after she graduated. She joined to be about air hostess in Cathay Pacific in Hong Kong. Okay, waiting for under review and publication in the future. I think it's gonna be good luck for her. Okay, and remain for my OT student master level. One to do for want to do for stroke client intervention in dialogue. Another one for interview with stroke client for OBI, occupation-based intervention. Another one for do with neurodivergent in work in occupation-based practice. Another one in do OT occupation-based intervention in hospital in Lopburi. Okay, this is why we can expand more in terms of OBP or occupation-based practice. But in the future, you can do in terms of client in pediatrics, okay, in mental health, in elderly as well, and mixed with technology and robotics as well in Thailand. This is I use about what we call Scorpus AI to generate occupation based to help to probe. In the future, if you can, you got the email or OTC or email CMU, you can register the Scopus, and Scopus got SI Scopus. It can generate look like what we call mind map. To know occupation based, you need to be reviewed and use standardized clinical reasoning, use questionnaire ready or not, article organization, and go to until to regulation. Okay, can help a lot. For example, this article is the key findings of this research. Occupation-based occupational therapy experience and perspective toward OBP in Thailand. OBP is the core. This is the finding core identity. OBP is the central for OT, as seen as the core identity and distinguish a professional in Thailand. But inside ADL is come first. ADL come first. Most common area that occupation within practice emphasize ADL therapeutic intervention. Cultural level one is implementing OBP must concern or must consider Thai cultural influence to ensure that practice cultural relevant fit with Thai context. This is still broad area. And educational ship is mean in university. At that time, we have just only 2 universities, Mahidol and Chiang Mai. Now we got 3. It need for make OBP curriculum, focus on OBP for the client. Now we change the curriculum 2021 already to be OBP, but it's not 100%, it's hybrid. But most of OT students from the 3rd year to 4th year, they still use about what we call OPP, and after that, OPP for find out about the client needs, and after that, in 4th year, second term for field work and first semester and second semester use about OBP framework, look like what we call OTPF framework to be draw about this word and go to intervene with the client. We change from long-term goal to be occupation-based goal. We change from short-term goal to be supportive goal. That is, we use like occupation-based, and under the small of supportive goal can build and can support occupation-based goal drive. It's not long-term goal a lot. Look like a short-term goal a lot. It's just only about occupation based on client. This is we do in educational level. Okay. The finding of this is value for Thai occupational therapy for its role to enhance professional identity and client outcome. This study highlight necessity and cultural relevant practice and for educational reform and revision support implementation for OBT Thailand. This is become to be occupation-based curriculum. Now we going on from this research. I done the research with Dr. Surinya, with Dr. Metisa at the time, and we can mapping between in Mahidol and in Chiang Mai. And now Sina Korean Travel gonna follow with this as well. Okay. And after that, this go to in-depth into about the stroke rehabilitation. I find out the key finding of the deliver of occupation-based practice for stroke rehab in Bangkok hospital at the time. This is kind of based on the outskirt area. Okay, the importance of OBP of this, I try to evaluate about this. OBP in Thai occupational therapy in Thailand recognize OBP is the crucial for professional identity and it can effective for stroke. Positive is implementing lead to benefit chain for stroke and highlight the value of therapeutic intervention. Still understand, but sometimes it's very hard to understand just only one word. But challenging is we can identify environment factor. Is the obstacle is difficult. Some hospital just only the orders from doctor, from your director, from your head. It can hard to use OBP in clinic, in the setting, due to small space, due to management service, due to many things, due to instrument and equipment as well. The research offer empirical evidence support integration OBP with that if we have this what we call ignite, now it might be transfer or transition hybrid between model of OBP and medical model together in terms of hospital because it still fit with the doctor, PT, speed, or nurse. We cannot use full function of 100% OBP in hospital due to length of stay, due to many factors, right? OBT need to be enhanced for quality in the future. And both of this is not, it look like the common theme, OBP. But this is I try to create this paper. In the future, when you present second semester, you need to present main paper and support paper, right? One is look like about what we call it. The first is take broad perspective of occupational therapy in many fields. But the second paper is just only OT in stroke. It's very specific, right? It's go to second is specific exam OBP in stroke rehab within hospital. Likely to be specific, just only hospital, but in Bangkok and outskirt area. Not up country, not provincial, or many up provincial like Chiang Mai, Chiang Rai, Songkhla. No, just only Bangkok. Methodology in the first is use mixed methods. Qualitative first. Qualitative use focus group. Follow with quantitative use questionnaire survey. Provide comprehensive view of therapies. But in the second, use just only qualitative approach. Draw just only about individual interview, just only one by one, not just only the group, and investigate the experience of them. They didn't meet together. They didn't come together. Just only go and talk and interview at their hospital. Okay. When data analysis, the first study use thematic analysis and descriptive is the same. The pattern is different. In summary, first paper offer the more holistic understanding of OBP among Thai occupational therapists, while the second paper narrow focus on just only OBP to stroke rehabilitation. Okay, this is how to create, how to critique and evaluate like these two papers. Okay, you're gonna know what inside. Last but not least, potential of occupation-based practice in Thailand, effectiveness of OBP. You can investigate impact of stroke, including functional improvement, quality of life, barrier. We can identify still not everything not smooth way, have barrier and have facilitator as well. Okay, hospital-based maybe got barrier a lot, but in community-based in the future that I done research now, it's got both. Facilitator is client can help, can unite relative, family, even though about people in that area. But the barrier is mean we lack of something. We lack of the what we call people understanding. We lack of some support from multidisciplinary team because they didn't understand about this. It might be the culture, individual factor as well. Therapist training need to be improved in the future. We not just only about focus on intervention, but we need to train therapy to understand, become to be OBP practitioner in the future. We gonna use patient center or not, but in the real in Thailand, might be client family center. It's not just only client center, like the model, okay, to explore how OBP align with client and their family model, okay. Collaboration and interprofessional practice, we need to find out about the common purpose between about client, because we cannot do just only OT. We need to combine with PT and speed. Cannot heal everything like OT. We help together with health provider, but OT do in our role to play, okay, role of occupation to be done the best. But in terms of PT, they're gonna support another thing about speed, gonna practice how to communicate, okay, to deliver about this, okay. And now I to do another my research with my student OT master level about experience of Thai occupational therapy on occupation-based practice in adult with physical dysfunction mixed method. The development of occupational-based practice delivered at long-term care community rehabilitation center or for stroke client. And the last thing is experience of stroke client for occupation-based intervention at community-based rehabilitation center in Chiang Mai province. This is undergoing for data collection. Okay. The last contradicts evidence is you need to be different conclusion that I sometimes what is about insight, what is difference, what is effectiveness, specific OT intervention, inconsistency in impact or not, or its consistency with occupational therapy specific client. Sometimes it cannot show it the same because it's still conflict. It still have different with perspective, with outcome, or with long-term outcome. Need to be debated, need to be discussed in terms of effectiveness of maybe traditional OT and innovative OT in the future. The last thing is about the contradictory view of OBP of OT research. We need to find out about research that you read, contrast your opinion, different your idea, and find out what about their difference, what is similarity, what is similarity. This is the main paper, and this is the support paper. It's held together, or maybe it can contradict together. Don't worry, you can pick up what is the common purpose. Occupational therapy regard the role of occupational therapy in distinct clinical environment and contribute or to the conflict viewpoint in the research. Some viewpoint of the research maybe come from their opinion. It may happen with some discrepancy with interpretation. It's very important. Sometimes different interpretation outcome of OT intervention have lead to contradicts. Like Malaysia think that they use OBI like this in Islamic community, sometimes cannot use in some area, like in acute hospital. To me, I agree with, but we never find out or discover in acute hospital OBP the best or not, or cannot use or not. Okay, Malaysia uses cannot use. Okay, but in the US can use just a little. It depends on transition. And the debate of impact, environment factor, effectiveness of OT. The debate should issue environment factor, client factor, or what is the factor is influence. We need to contradict and debate together. What is the viewpoint? What is the difference? Maybe in experiment from Thailand, from Japan, why different? Use the same way, use the same protocol. It can be conflict. Okay, conflicting perspective on cost effectiveness. This is my link to the money, link to about the support from the government, link to about the cost that you provide. Thailand now we use about money for, sometimes we try to use universal scheme, right? And use about civil servants corporate fund, or sometimes you use about social corporate fund. Is another cost benefit for use effectiveness or not in terms of OT, effect or not about money to find, to prepare something, need to be find out for the future. Okay, most of this you're gonna be analyzed and conclude about the future. The first is meta-analysis of occupational therapy in terms of synthesizing need to be more, not just only about my perspective viewpoint in terms of OBP, need to do about analysis about occupational therapy in terms of intervention and condition with specific or different population. Longitudinal study need to be planned more, not just only short course or short term. And we need to add up with qualitative study for show it another way in another paradigm of qualitative perspective from the participant, from the client, or from family. Survey for OT still one area we try to find insight of perspective of the therapist to know the current trend, to know about the perspective in the future in OT now. Look like a trend of new technology, AI gonna affect to help OT, to Thai people or not, to help the client, telehealth and telemed, or robotic gonna do better than therapist or not. I used to ask professor from Taiwan about AI gonna affect occupational therapist or not, or can work or not. He think if it depends on you, they believe the occupation that human do, the robot cannot do more, but can help the therapist. Okay, think about empowering or empowerment for the client center, cultural or advocacy or policy and integrative with justice. Now the world changed a lot. The world have the war. The barrier between Thai and Myanmar, they're in front to Thailand a lot. We need to keep occupational justice. We need to open, practice autistic disorder. Some disorder come from not just only Thai people, they come from ethnic minority. We need to taking care in Sarapi sub-district or Sarapi district, open or Sansai hospital. Sometimes we need to work with not just only the Thai, but Myanmar people have a lot. Okay, we need to provide about this occupational justice as well. Embrace client center goal setting for the client, set collaborative goal and go with the client in terms of their need. They want to do like this and their journey at the OT to give intervention. Okay. Keep in mind that when you explore with innovative approach or innovative technology for OT, think about in terms of potential about virtual reality in the future. It comes very quickly. Look like we are promote lifestyle redesign, health promotion. Now we have older people a lot. We become to super age society in the next 10 years or 7 years. I know in most country, most province in northern of Thailand, like Lampang, become to be super age society already. Health promotion for older people need to be implemented. Integrate animal-assisted therapy still important or not. Dog therapy, or even the elephant therapy that seems to is the look like a soft power. It still become to be a soft power or not about animal-assisted therapy. Or we gonna use some another machine or robot. Okay, explore about sustainable and ecological brain intervention. We think about sustainability occupational value, promote environment to be look at friend to like ecosystem for about the OT. Thank you very much indeed for your attention. I think I record already and think that you're gonna what we call keep in your mind in terms of when you read, you select already that is the paper and how to create critique, how to re-evaluate, and not just only present this paper, but present with about common, present about this similarity, what is different, what is the idea linked together from this paper. Sometimes it come from another publisher, but you got idea already. In the future, you can, if you do like this better, you're gonna make discussion very smooth. If you just only present, just only prioritize with about what we call with some year, sometimes you do with literature review better. If you do with critique, you can analyze like this. You can make discussion better because you know situation and you know different, you know similarity or common purpose together. Okay, in terms of research paper, sometimes you use about 3 or 5 or just only 2 paper, up to you when you present in the second semester. Okay, this is the name of Barack Obama again. Keep exploring, keep dreaming, keep asking. Why don't settle for what you already know? Never stop believing in the power of your idea, your imagination, your hard work to change the world. Thank you for attention. Okay, back to the Thai mode.